Hi everyone, it's Dr. Hall, and today we're going to do the external heart. So I've got some light blue clay and some pink clay for my right and left sides of the heart. I have a little part separate that's going to be for the auricles. So now I'm going to go ahead, I'm actually going to take some of this off because the right side of the heart's a little smaller than the left. And I'm going to shape the right side of the heart. So at the top we're going to have the atrium, which is kind of a square boxy thing, and then below that we're going to have the ventricle, which is kind of triangular coming down. All right, so when we're looking at it from the outside, it's going to look somewhat like that. We're going to go ahead and do the left side of the heart. Left ventricle is bigger than the right, and the atrium up top. And so it's going to be somewhat like that. Now I'm going to add the auricles. And so these are these little, auricle means little ear, so they look like these little flappy ears. So here's the left auricle sitting on top of on the anterior surface of the left atrium. And I'm going to do the right auricle, which is going to be doing the same thing on the right atrium. So we can see that naturally, well, I use different colors, there's a division here between the two sides of the heart. So this is going to be the anterior, because it's on the front side, interventricular, inter means between, sulcus, sulcus means a groove. On the posterior side, we're going to have a posterior interventricular sulcus. We also have another sulcus, which is the coronary sulcus, and that comes across, that's a groove between the atria and the ventricles, and that's going to actually continue around all the way around the heart. So a sulcus is a groove. So I'm going to go ahead and add some of our major blood vessels, which are often referred to as the great vessels. So our superior vena cava is going to be coming down and emptying into the right atrium. The inferior vena cava is going to be ascending, right, coming up from the lower part of the body and also emptying into the right atrium. The left atrium, of course, is going to receive blood from the lungs, right? Receiving that oxygenated from the lungs through the pulmonary veins, right? And so this is one of those weird situations where it's a vein, but it's bringing in oxygenated blood, because the definition of a vein is that it is bringing blood to the heart, not necessarily that it's carrying deoxygenated blood. So veins carry blood to the heart. So these are veins carrying blood from the lungs, freshly oxygenated to the heart. There are 4 of them, superior and inferior, the left superior and inferior, and the right superior and inferior pulmonary veins, bringing oxygenated blood into the left atrium. So that's what we've got on our posterior surface of the heart thus far. For our great vessels on the anterior surface of the heart, we've got the pulmonary trunk and the aorta. The aorta, of course, is coming out of the left ventricle, and it's going to ascend and then go into its arch. Coming out of the right ventricle, we have the pulmonary trunk. And the interesting thing about the heart is the pulmonary trunk is the most anterior structure. And it's going to cross over the aorta here, and then the pulmonary arteries are actually on the right, they're actually going to go through and behind the aortic arch. So there is our pulmonary trunk. So now it's time to go ahead and add the coronary vasculature, right? So we're going to be adding the blood vessels that supply the tissue of the heart itself. So I'm going to go ahead and start with the left coronary artery. It's going to come off of the aorta. It's one of the first blood vessels to come off the aorta. And then it's going to branch into two different arteries. So the left coronary artery itself is only about a centimeter or so long, and then it's going to send one branch that's going to travel over into this anterior interventricular sulcus, and so that is often called the anterior interventricular artery or the left anterior descending artery. Both titles are correct. So we've got the left coronary going into the LAD, left anterior descending, and then it also splits off another artery that continues around posteriorly here and goes around, and that's called the circumflex artery. So it's nice when things make sense. So there's the circumflex artery, and that'll send some branches down to the left ventricle. On the right side, our right coronary artery is going to come off of the aorta, opposite from the left, travel in this coronary sulcus around posteriorly. I'm going to remove the inferior vena cava for a moment. We're going to talk about this in a bit. I'm also going to remove my pulmonary trunk just so you can see a little bit more easily what I'm going to add next. There is a tiny little artery that comes off of the right coronary artery and travels superiorly, often deep to the auricle. And that is the anterior right atrial branch. And the reason why that artery is important is it's actually going to supply the part of the heart that sets the rhythm, right? So the pacemaker of the heart, the SA node, which is located back here in the right atrium, the anterior right atrial branch is going to supply that part of the heart. So it's clinically quite relevant. The right coronary artery is also going to send off another branch kind of over here on the right lateral side of the heart, and that is called the marginal branch. So our right coronary artery goes off the anterior right atrial branch and the marginal artery, and then when it circles around and then it descends in this posterior interventricular sulcus, it is called the posterior interventricular artery. Okay, so that's actually a continuation of the right coronary artery, but we give it a new name, posterior interventricular artery. Now, so we've got our coronary arteries in place, right? Here's our pulmonary trunk. Now we need to put the veins, right? So the heart muscle also needs to be drained by veins so that the deoxygenated blood can be returned to the heart to get pumped out to the lungs. So we're going to have a vein that travels with the left anterior descending. Now, you know, the left ventricle is kind of a big shot. So if you get to travel with the artery that supplies left ventricle, you're pretty important. So this is called the great cardiac vein, and it is anterior. We will almost always find that the veins run anterior to the arteries. It's going to run anterior in this interventricular sulcus, the great cardiac vein, and then it's going to come around posteriorly, and it's going to empty into a very large vein. It's very impressive when you see it, which is called the coronary sinus. So when we have very big veins in the body, they are often called sinuses. And so that's different from the sinuses that are in your nose. And we also have to remember to keep that distinct from a sulcus, which is a groove. So a sinus is a big vein. And that coronary sinus is actually going to empty into the right atrium along with your superior and inferior vena cava. So the right atrium is receiving deoxygenated, used up blood from the upper part of the body through the superior vena cava, lower part of the body through the inferior vena cava, and from the heart muscle itself through the coronary sinus. All right, we're also going to need some veins to drain other parts of the heart. So I'm going to add, so we're going to have a vein that travels with the posterior interventricular artery, and it is going to drain into the coronary sinus, and that is called the middle cardiac vein because it's kind of in the middle of the back. So that's the middle cardiac vein. And then coursing along with the marginal artery, the marginal branch, is a teeny little vein that I just broke called the small cardiac vein. So the small cardiac vein is going to drain blood from this same distribution, come around posteriorly in that coronary sulcus, and drain into the coronary sinus. There. Okay, so we've got all of our structures, and now I'm just going to go ahead and do a review. So we have our pulmonary trunk, our aorta. The aorta has our left and right coronary arteries coming off of it. Let's look at the coronary circulation, starting with the veins. Great cardiac vein comes around posteriorly, empties into the coronary sinus. Middle cardiac vein and small cardiac vein coming in here. So I'm going to go ahead and remove those veins so we can review the arteries. So the left coronary artery branches very quickly into the left anterior descending artery and the circumflex artery coming around posteriorly. The right coronary artery sends off the anterior right atrial branch. Then we have the marginal branch, and then as it continues around posteriorly, it descends in the posterior interventricular sulcus as the posterior interventricular artery. So there's our coronary circulation. Remember, we have our two auricles, right auricle, left auricle. Right atrium, right ventricle, left ventricle, anterior interventricular sulcus. We have our superior and inferior vena cava emptying into the right atrium along with the coronary sinus. And we have the left and right superior and inferior pulmonary veins draining into the left atrium. So those are the external structures of the heart. Next time, we'll take a look inside.